Now this is a very interesting CT scan. You can simply pause the video and or you can zoom in and you can try to find out what is the problem in this particular CT scan of the abdomen. Now we know that this is CT scan of the abdomen because we can see very crystal clearly the liver, spleen, and we can see the kidney, right kidney and left kidney. So this is definitely abdomen. And when we try to see, we can see the small intestine. It is very easy to understand the small intestine because the small intestine will be in around center of the abdomen, whereas the large intestine will be outside or towards the periphery of the abdomen. So this portion is all transverse colon, and this portion is of this is right side, so this is definitely ascending colon, and on the left side we'll have descending colon, which will get into sigmoid, rectum, and this then anal canal. So we can see the large intestine, small intestine, liver, spleen, and everything. Now we must know that on the CT scan of the abdomen, dense white structure is either blood or bone or calcium, or in this case it is contrast. This is our oral contrast because this oral contrast is given so that the visibility can be much better. So this is our oral contrast which is given in this particular patient. The IV contrast is not used in this particular image because we can see the aorta. This is aorta, this is vertebral body, and just in front of the vertebral body towards the left side we can see aorta. So this is aorta, we can see this is aorta, we can see this is aorta. So in aorta there is no contrast. In this aorta there is no contrast because the contrast will look very dense white like this. So this dense white or hyperdense structure will be the contrast, but in here we can see this aorta has no density, radial density. So the IV contrast is not in this particular image. The oral contrast is definitely there. Now what we can see, the dense white structure will be either blood, bone, calcium, or contrast. And so apart from that, what we can see is soft tissue. So soft tissue will not appear black, they'll appear whitish, but they will not be as white as the bone or other these things. The air will appear pure black or jet black like this. So this is air. So this is the air into the intestinal system. This is air. This dense black is air. So dense black is air. And these are all muscles. These are all muscles of back because this is spine. This is vertebral body. So this is all. These are the back muscles. These are erector muscles which keep our back straight. So we can see this is the density. This is the radial density of soft tissue. So now we know that density of blood, calcium, bone, contrast, they will be dense black. Air will be dense black. Sorry, the bone, blood, calcium, contrast, they will be dense white, extremely white, glistening white. The air will be dense black. The soft tissue will appear whitish and definitely not blackish. So this is all the muscles or the soft tissue which is there. So apart from that, only one thing remains, and that is water. So water will appear blackish, but it will not be as black as air because it is dense. Now when we see, this is bladder, this is urinary bladder, and bladder is filled with all urine, and you can see the bladder, we can definitely very easily say because this is very perfectly uh, demarcated. So this is all bladder, this is urinary bladder where you can see the urine is accumulated. So this is the density of water. So this water density will be radiolucent or blackish than the soft tissue. See this soft tissue, this is the soft tissue. So this will be blacker than the soft tissue. So uh, so it will be less black to air. So if we want to come to know, the most black structure will be air. The less black than air will be water. And everything more than this black will be soft tissue, and after that the dense white structure will be bone or calcium or contrast or the calcium. So, or blood. So in here, what we can see, this is definitely water and this is soft tissue. Now what I want to tell you, we need to understand the difference between water density and this soft tissue density. This is soft tissue. Now, when we see in the abdomen, usually you don't have free flowing water. Free flowing water or freely accumulated water in the peritoneal cavity is called ascites. And what we can see here, if you can compare this all to this, they are same. So this density and this density is same. It means there is all water accumulated in the peritoneal cavity, and free water in the peritoneal cavity is called ascites. So in this patient has huge ascites. So you can very easily notice this all is ascites only. This is all ascites. This is all ascites. And this is basically the peritoneum. This is the layer of peritoneum. And peritoneum is everywhere. Peritoneum is present around the liver, around the spleen, around the small intestine, large intestine. It is the coverage. It is the covering of, in short, all the abdominal organs for the smooth functioning. So this is all water, means the patient has extremely gross ascites. We can see the gross ascites here because this is the radio density of water. Now, to have ascites, we must have some inflammatory process somewhere. The patient must have some inflammation. So you should always try to find out whether there is any kidney inflammation, there is liver inflammation, there is spleen inflammation, or gut inflammation, or there is any swelling, is there any abnormality or discontinuity in the continuity of a particular organ. So that is the reason why we always trace each and every organ, whether this organ is perfectly aligned or not. For example, this kidney, the right kidney is very well perfect. It is very much smooth. The left kidney is also very smooth. This is definitely right side. So this is liver, and here will be spleen. So we see that liver is very well demarcated. The spleen is very well demarcated. There is no any discontinuity, or there is no any obvious like tumor or mass, or there is no infiltration or inflammation. Otherwise, we can see a fat penetration. Whenever we see fat inflammation, we'll automatically see these whitish lines, which suggest that fatty infiltration. So in this particular patient, what we can see, that there is so much of accumulation of free water, that is ascites or free fluid. And when we have done there is no contrast in the blood vessel, there is contrast in the small intestine. So when we have done the contrast imaging of the same patient, what we saw is there is significant, you can simply try to see what is the finding in this particular image. So in this image, what we can see is that earlier the margins of this peritoneum were not that much appreciable, but in this we can see that, see, look at the peritoneum. So this appears so much of white. So in earlier image, that whiteness was not there. If we can simply pause the video, we can go back. You can see the margins of this peritoneum, they look enhanced. You can see the whitishness. You can see that whitishness. You can see the nodularity. You can see the enhancement, what we call it as enhancement. So before giving contrast, this type of glistening white lining was not there. But after giving contrast, in this image, we can see this is the aorta, and aorta looks dense white. The dense whitishness is because of the presence of the contrast in the blood vessel in the aorta. We can see this is the aorta, and it shows dense white density. It means the contrast is given. So this is post contrast imaging showing enhancement of the peritoneum and a nodularity. You can see that this all peritoneum is showing this whitish enhancement, which was not there earlier, which is around the liver margins, which is around the spleen margins. So there is enhancement of this peritoneum, especially after giving contrast, which suggests that there is peritoneal inflammation, because contrast enhancement will be only then if there is increased blood flow to that particular organ. Enhancement means what? The peritoneum was having less blood flow, so it will not take much contrast. But if the peritoneum is inflamed, automatically the blood flow will increase to that peritoneum. So if blood flow is increased, automatically the contrast will get accumulated more, so that it will appear more white because of the accumulation of more contrast. What we call it as enhancement of the peritoneum. So we can see these margins. So this is peritoneum, and it looks so dense white because after giving contrast, there has been enhancement of the contrast, enhancement of this peritoneal lining. So it simply tells us that the patient has gross ascites. And why is that? Because of we have not found any particular lesion in the liver. You can see there is no any particular lesion in the liver. There is no any particular lesion in the spleen. There is no perihepatic or perisplenic infiltration of the fat. So there is no actually any problem of kidney or liver or spleen, but it is the problem of peritoneum, because the enhancement of the peritoneum is increased because of the contrast, and this increased peritoneal enhancement means peritoneal inflammation is causing sipping of the fluid from the peritoneum to the abdominal cavity, causing the ascites. And this is not only the thing, we can also see that this type of enhancement of the peritoneum is around the intestinal coils as well. If you can see here, if you can see this area, this is the definitely intestinal part, and the see here there is whitish enhancement. You can see there is whitish enhancement around this intestinal loops, means intestine, small intestine, large intestine. It is usually covered by omental fat or omentum. So omentum is kind of all significant accumulation of fat or fat, so that it can create a very smooth functioning of all the small intestine and large intestine. So in here also you can see this, there is subtle whitish or enhancement around the omental patches. So there is enhancement of the peritoneum around the around the liver, around the spleen, around the intestinal coils, suggestive of peritoneal inflammation or peritonitis, causing ascites. And in Indian context, it is almost always abdominal TB or peritoneal TB. So this is very highly likely to be peritoneal tuberculosis, causing increased enhancement of the peritoneum and gross ascites. Such patients should be always done with ascitic tapping. Ascitic fluid should be centrifuged. It should be sent for acid fast bacilli. It should be sent for gene expert. And peritoneal TB, we always say ki it is almost always because of the hematogenous spread. So most of the time the patient will have pulmonary lesion. So chest X-ray or HRCT chest should be always done to find out miliary tuberculosis or tuberculosis pulmonary involvement, and it should be always evaluated to diagnose whether the patient has TB or not, and the patient should be treated with anti-tubercular medicines from 6 to 9 months. That's all, and thank you.